Dr. Shannon, we have talked a lot about missing teeth and stuff. When people have teeth missing, and also people who have no teeth missing, quite often that seems to be throwing the whole mouth out of alignment. I mean, we know that a missing tooth is subject to make other teeth woggling around next to it, but the whole jaw, everything, the hinges, everything seems to be maybe easily getting out of alignment. And the cause of it, people tell me, dentists tell me, that you can get neck pain, shoulder pain, tensions, and even headaches. Did you see that with your patients in real practice, not just in theory?
Yes, absolutely. A lot of people, let me back up just a little bit. We'll take this a couple little steps at a time and little bites so that it's understandable, because this is actually a very complicated area. People hear this expression TMJ, and they're really not sure what that means. It's kind of a mystical thing. What is this TMJ stuff? And all it really means is the jaw joint, which, of course, hinges in front of the ear. I'm wearing these large Mickey Mouses here, so it's hard to point, but right in front here, that's where it hinges. Now, most joints in your body, your elbows, your wrists, they lock in, and there's only one place they can be. That's the joint. You can move just so far, and that's all it is. Well, unfortunately, the joint for your jaw, the TMJ or the TM joint, is not like that. It sits on the base of the skull, which is curved like this, and the jaw, instead of it locking in a ball and socket, it just sits there, and it's flat. And it can move anywhere it can, so it can actually be dislocated very easily. What holds it in place is a series of ligaments, and they're in balance. And what keeps them in balance is the fact that there's no stress on them. So if you were to chew on one side for 10 or 15 minutes, say you're chewing gum or you're chewing a piece of tough roast beef or something, after a while that side's going to get a little achy and you're going to feel it. Now, you may not stop chewing, but then what you'll do is you'll switch it to the other side. That's what I mean about fatiguing, and that's what I mean about being in balance. When you lose teeth on one side or the other, if things shift and if things happen, if those teeth are not in the exact alignment they should be in, then you're going to get fatigue in those joints. Now, there's nothing your teeth can do to help that fatigue, but there is something your muscles can do. And some of them may tighten and some of them may loosen. And as it does that on your head and in your neck and in your shoulders, you're going to be compensating to try to make your jaw comfortable. And this is all subconscious. You're not saying to yourself, well, I'm going to relax my left side and I'm going to tighten my right side. These are things your body does. And then you wind up with a headache. Maybe that sits right across that muscle. It could be anywhere from above the eye to the middle of the head to the back of the neck. So you run into the medicine cabinet and you grab a couple of Advil or Tylenol or whatever you like to take for a headache. But that's not really the issue. The headache is the symptom. The issue is the muscles. And these muscles that tighten up can tighten up so much that, talking to my chiropractor friends, they actually have to do adjustments on people's necks to get these bones to go back into position. And they'll go back, and they'll stay there for a little while. But if the teeth are not evaluated, if the teeth are not brought into the equation, then you're just going to keep going back for one adjustment after another, because those muscles are going to tighten up, those headaches are going to come back, and then those neck bones are going to go out of spot.
Interesting. Well, there's a very interesting point you said, which I haven't heard anybody saying, is that the hinges in your mouth, they're not like a socket and a ball in it. They're kind of like two flat things. So very obviously they move. They're easier to get out of alignment. So I guess even a little car accident, a whiplash, or the teacher kind of like hitting you a little too heavy, too fast in the back, and when you were small, could bring that out of alignment.
Private school education.
and you can get all kinds of tensions. So let me ask you: is it advisable for a person who had, when he gets to sleep, he, wakes up sore, in the neck, in the back, maybe has headaches, has tried a few things, has taken his share of aspirin and Tylenol, has gone maybe to some doctors, even chiropractors, and yes, it helped, but it keeps coming back. Is it wise for him? Is it prudent for him to say, you know what, let's go to a doctor and check out whether my chas, my teeth, my mouth, my bite, as you guys call it, is out of alignment? And if it is, you can fix it, I suppose. And if it isn't, at least the guy knows that it isn't that. Keep on looking for what it is. It's not the mouth.
Correct. Yeah, I mean, all things should be considered, and people don't think of the teeth. A lot of the doctors don't even think of the teeth, although I have had a few referrals from some very knowledgeable doctors who have said, you should see your dentist, you may have some TMJ problems. And there is a very specific way of going about making the diagnosis. And not all dentists know how to do that. We all know how to deal with certain aspects of it, but you want to be able to go to a dentist who can properly diagnose it through the use of certain methods and can also correct it and can at least recommend what the correction would be, and then go ahead and take care of it. It should be a very straightforward, it should be very simple to understand once it's explained to you. It shouldn't seem like it's a mumbo-jumbo type of science, thing that's too much for the person to understand. It can be broken down into very simple terms, and it can be resolved in a very simple way, as long as the patient goes to a dentist, because a physician or a chiropractor will not know how to approach it from a dental standpoint.
Right. And you explained it very well. Are you such a doctor, by the way, able to go for this type of things?
Yes, I have had a lot of training in TMJ treatment, and I have had a lot of success with a great number of patients. So, yes.
Wonderful. I like it. One more very important question. What are those boxing gloves behind your head up there?
Yes, they are. They're actually signed by Muhammad Ali. I can't say that they were used by him. I'm not sure if he actually used them. Supposedly he did, but they're signed by him, and I was lucky enough to be able to get a pair of those. I was a big fan of his in the boxing world. My father was very much into boxing growing up.
I see. So are those the type of gloves you're wearing when you knock out a patient before you do a root canal or something like that?
No, actually, I use a ball-peen hammer. It's much more effective, Helmut. Come on down to the office, and I'll show you how we do it.
Oh, wonderful. Thanks a lot, Dr. Shannon. Bye-bye.
Sure.